streaming this on the Growth Dimensions YouTube channel.
Just to let everyone know, we're live streaming this forum today on the Growth Dimensions YouTube channel. We're having a really good attendance, everyone. So I'd just like you all to know we're going to wait just a couple of more minutes, let a few more participants sign in. We'll be with you in just a few minutes. We're having one small technical difficulty with YouTube Live. So we're going to wait just a minute for that to get started so we can put this on the YouTube Growth Dimensions channel. Be with you all in just a second. Continue to work on it and we'll get started. Good afternoon, everyone, and welcome to today's Forward Forum, where we will be discussing some health department highlights, Belvedere School District's back to school plan, childcare options and resources. Just a couple of housekeeping items. This webinar is being recorded and will be made available to the public later. Also, please feel free to submit your questions throughout the presentation using the Q&A feature. We'll be answering questions at the end of the presentation. We just ask that your comments and questions remain respectful. I'd like to take just a brief moment to introduce myself. I'm John Wolf, and I will act as today's presentation facilitator. I'm currently the board president of Growth Dimensions, Economic Development in Belvedere and Boone County. Growth Dimensions is also a Forward Boone County partner who I am here representing today. Forward Boone County is a partnership that was created to help Boone County businesses, employees, residents transition through the Restore Illinois phases. But more than that, there was an insurmountable amount of information happening. And we knew that we had the responsibility to narrow that focus to what really matters right here at home. Forward Boone County is made up of public and private entities, and we continually meet to ensure that we are providing relevant and timely information to our friends and neighbors here in Boone County. Well, let's go ahead and meet our panelists today. First up, we have Amanda Mail. Amanda is a public health administrator for Boone County Health Department. With 14 years in the health industry, Amanda has been with the Boone County Health Department since 2012. Next, we'll hear from Dr. Dan Weisman. Dan took the helm at the Belvedere School District in 2016 as superintendent and has spent 15 years in the education field. We're also pleased to have Jen Jackie joining us from the Belvedere Family YMCA. In 2011, Jen joined the Belvedere Y as the executive director. She has been instrumental in developing childcare programs and initiatives in the area ever since. And last, but certainly not least, we have Mark Pentecost. Mark is the executive director for the Belvedere Park District and has been with the Park District since 2007. Let's go ahead and get started with today's presentation. We have a few different topics to discuss today. We'll be starting off with the Boone County Health Overview, then move into the detailed District 100 Return to School Plan. Our last two topics will focus on childcare resources, options, and fall camp opportunities. Again, I'll remind everyone to please submit your questions using the Q&A feature, and we'll answer those at the end of today's presentation. Amanda, why don't you go ahead and get us all started?
Great. Thank you so much, Mr. Wolf. Hi, everyone. Good afternoon. Amanda Mail here, the Public Health Administrator at the Boone County Health Department here in Belvedere, Illinois. And I'm going to kick off my presentation here talking just a little bit about the role of health departments, specifically related to COVID-19 planning, preparation, and response efforts. Talk a little bit about supporting school districts and other entities and organizations within our communities as we work through that prevention, response, and restore activities. And then I'm going to touch a little bit on the data. I'm going to talk a little bit about COVID-19 here in our local community, talk about COVID-19 in our region, and then also at the state level. So I'm going to move to my next slide, and I would just like to discuss very briefly a little bit about the difference between our state health department, so our Illinois Department of Public Health, and then our local Boone County Health Department. So the role of our state health department is to provide guidance and oversight to county health departments. We are a decentralized state, which means that the state health department has deputized and certified local public health departments with that certification status to work very tightly with their community partners to assess situations such as this and push out guidance and recommendations that have been brought forward at the state level. So we are providing guidance to businesses, organizations, and residents, and that includes schools and child and daycare programs. And then taking that a little bit further at the local level, in addition to providing that guidance, it's also our role to ensure that that guidance is followed here locally. That's something that the state health department has deputized us to do. We're also responsible for educating the public on health concerns, and in this case, especially combating local spread of the COVID-19 virus. So we'll move to our next slide, which talks a little bit about Restore Illinois. So Restore Illinois is the statewide plan consisting of 5 phases. And this has been a phase in reopening and restoring approach to our journey with COVID-19. We are currently in phase 4 of the 5 phases of Restore Illinois. And just to provide a brief overview, phase 4 includes the allowance of gatherings of up to 50 people, assuming that the space provides for that. So I do want to clarify that if it is a very small space, if 50 people cannot fit in that small space, spaced out, wearing masks and being 6 feet apart, then it would need to be a smaller occupancy. But the total amount of people that can gather at any one time right now in our phase 4 is 50. Travel should follow the state health department and then the national level Centers for Disease Control guidance. We have gotten some brand new information from the state health department on certain states that are in warning status for travel, and that has been posted on our website and is being shared with Forward Boone and will be made available to all of you as well. So that will be a constantly changing set of guidance as things evolve in different states across the nation. Healthcare facilities are open using state health department safety guidance, and we have pushed that information out to our local primary care providers, clinics, emergency departments, and other healthcare facilities here in Boone County. For education and childcare, K through 12 schools, higher education, all summer programs, and childcare are open if they can safely do so while following IDPH, Illinois Department of Public Health approved safety guidance. So the way in which that looks locally is going to depend county to county, region to region, across the state, as decisions are made as what is in the safest interests of our students and our teachers and our community. Outdoor recreation is allowed at this time. And again, if people are congregating together for gatherings, the capacity for that, whether you're indoor or outdoor, is 50 people. So we'll move to the next slide. So I did want to give an example of sort of the timeline in which our most recent conversations have occurred, working very closely with the schools in our county. So our 2 public school districts and our private and parochial schools. We assisted our schools back last March when they went to virtual and finished off that school year, and then began to work with the state health department to seek guidance and information to then work over the summer with our schools on a series of planning calls where we discussed different scenarios. We looked at safety, we looked at logistics, we took a look at planning. And I will say that this is such a challenge during COVID-19 because the moment that you have a new set of guidance documents and you push it out and you go over it locally and everybody's starting to get their questions answered, unfortunately, the nature of COVID-19 is that something has changed before we've even made it through the first set of guidance documents. So that is and will continue to be a challenge as we move forward with our journey with COVID-19. So I'll move to the next slides, which talk about COVID-19 here in our local community. So I'm on the slide that is labeled Daily Report COVID-19, and many of you may be familiar with this slide because this is information that we put on our social media outlets and on our website, and we push out in a daily email to all of our partners. So just to give everybody a situational update, and this is current as of today, Boone County has had a total of 822 cumulative positive cases. We've had a total of 23 deaths in our county, and we're pleased to report that we've had a total of 694 recovered cases. And then we always list the state of Illinois as a comparison so that you all can see the number of positive cases, 215,929, and then unfortunately 7,857 deaths. We put out information on positive cases and deaths by age, and we break that down for all of you. We also list areas of concern, and we've been working very hard with specifically our long-term care facilities, really since the spring, to manage and mitigate the spread of COVID-19 within those facilities. We're very happy to report that after working with several of our facilities that have been areas of concern over the last 4 to 6 months, that we currently have no areas of concern within our long-term care or assisted living facilities to report. That's a very positive data point that I would like to bring up. The next slide talks a little bit about the COVID-19 confirmed cases by symptom onset date. That's also something that we track. So we receive lab reports from providers that have tested Boone County residents for COVID-19. We receive negative test results and positive test results, and we track all of the confirmed cases by symptom onset date. We will oftentimes get a report a little bit after somebody has tested positive. It depends on how quickly that provider gets that information to us. But all providers are mandated by state statute to report cases of COVID-19 to the local area jurisdictional health department. Also on this slide, we have a breakdown of cases, cumulative cases by zip code, by community spread versus outbreak setting. To mention age already, we look a lot at our congregate versus non-congregate settings. And I want to emphasize that congregate settings are not only long-term care facilities. A congregate setting could be a manufacturing plant. It could be a large workplace. It can be a school. It can be a facility where groups of individuals are coming together on a regular basis and are potentially coming into close contact. Our next slide breaks down our COVID-19 cases by race and ethnicity. We've been working very hard here locally to address the disparity that we have continued to see in cases amongst our Hispanic Latino population. So I do have a breakdown based on the reports that we put out every couple of days where we look at the numbers by race and ethnicity. And we know here in Boone County that about 22% of our population demographically, according to census data, considers themselves to be Hispanic Latino, but we see rates over 50% within our Hispanic Latino population as far as proportional to our cases. So that indicates to us that we do have a health disparity there. Some of the ways in which we work to combat that is that we have hired bilingual contact tracers. We have bilingual resource coordinators here at our health department. We have several bilingual nurses, and we do translate and push all of our materials out in English and Spanish. We're starting an exciting new project where we are going to be using GIS mapping to take a look at areas in our community where our Hispanic Latino families are living and working to do some coordinated outreach in those areas going forward. Our goal is to keep our rates as low as possible. Our goal is to try to contain and mitigate the spread of COVID-19 as much as we can. And continue to meet the state metric requirements for where our data is, showing that we would be in the safest possible position we could be as a county. That's a huge job that we're charged with. And a lot of you on the call have assisted with that. So I'll move to the next slide where I'd like to talk a little bit about the region that we've been grouped in as part of the Restore Illinois process. So we've got our map of the great state of Illinois here, and we've been divided up into multiple regions coordinated by the area of the state in which we're located. So this newer approach to Restore Illinois has been extremely helpful because it has allowed us to focus more on our immediate region, which encompasses 9 counties in the Rockford area. stretches all the way from our border and the DeKalb County border with the counties that are hitting east towards Chicago, and goes all the way to the Iowa border to the west. So there are 9 counties in our region, and we're looking for specific data points. So we're watching for new cases per 100,000. We want to see cases to be 50 or fewer new cases per 100,000 in any given county at any given time during a week period in which this is being monitored. We're also monitoring number of deaths. We're monitoring weekly test positivity. So this would be something that we would want to see always under 8% at this point. We'd like it to be well under 8%, and we don't want it to climb anywhere close to 8%. We're watching ICU bed availability. We need to make sure that we have enough space at our hospitals to accommodate people who fall ill with COVID-19 and need intensive treatment in an inpatient hospital setting. We're watching weekly emergency department room visits. So we would be watching for people who present themselves at the hospital with COVID-like illness and are being tested for COVID-19. That will also indicate whether we have enough space within our healthcare facilities to accommodate the possible increase in a number of cases, or what we would call a surge. We're watching for weekly hospital admissions, also looking to make sure we have enough space in our hospitals to accommodate the care that is needed by patients that fall ill and have a more serious level of disease with COVID-19. We're watching to see the number of tests that are performed. We want to make sure that testing is available to our residents and available to our region, so that if people are having symptoms, they can go and get tested. We can detect it early, and we can begin our contact tracing process. We're finally looking for clusters. We're watching for, I mentioned congregate care settings, whether it's a workplace or a school or another facility where people are gathering. Watching to see if we have outbreaks or what we would call hotspots in specific areas. So this just gives you kind of an idea of all the behind the scenes work that goes into providing the data and the science behind decisions that are made as to whether a facility needs to close, or whether a facility needs to limit operations, or whether as a county or a region, we need to make some additional restrictions so that we can keep people safe and healthy. So we'll move to the next slide. This is the new cases per 100,000 and shows the counties that are currently in warning status. So I mentioned that we have 9 counties in our Rockford region, and 7 of our 9 counties have been in what we call warning status for the 50 or more per 100,000 population. And you can kind of see the breakdown here. So the way that the warning status works, just so that all of you know on the call, when a school or a daycare program or a manufacturing plant or a church or another facility calls to ask a little bit about what they are permitted to do, or kind of what are the rates looking like, or what are the numbers looking like, this is the information that we would push out to them, right? And so currently, we've been in warning status for being over 50 per 100,000, really for multiple weeks now. The entire county goes into a warning status if 2 or more of the metrics that I mentioned on the previous slide, those 7 or 8 different targets that we're watching for, whether it's hospital admissions or ICU bed availability, testing, if we go into warning status for 2 or more of those. So right now, Boone County and several other counties in our region have 1 orange metric, but we are not at a 2 or more level metric at this time. Next slide. So we'll take a look at, again, a statewide map showing where we currently are. Next slide should move us to that statewide map. So you can see the counties that as of yesterday were in blue, which means they have no more than 1 or fewer warning status metric. Any county in orange is at 2 or more warning status metrics. We did literally 20 minutes before this call started get the press release from the state health department that there are 20 counties that are being reported in warning level for this week ending 8/21/2020. And none of those counties, thankfully, are in our Rockford region and our 9-county region. So that means that we are doing an excellent job here locally of getting information out. We have quite a bit more work to do, but we have done a substantial amount of work, and we will continue to watch those rates and monitor those metrics. So that is the last part that kind of wraps up my overview of public health and what our role has been here locally. And before I turn it back over to the other presenters that are on the panel, I just kind of want to set the tone and the stage for what I'm hoping that our group can put out to all of you today. So just a couple of guiding principles that I think are really important. And I think the health department believes very strongly in supporting all of the organizations that are represented on the call today and the hard work that they're trying to do. So I just want to validate for everybody who's listening and who's participating in today's call. I want to validate how hard this is, right? This COVID-19 process is not easy. It's not going to get any easier. And I just want to recognize for the parents, the teachers, the community members, the organizations that are on the line, that the health department recognizes how hard this is. We also feel how hard this is, and we would like it to be over, but it is not going to be over anytime soon. I also want to recognize that the organizations that are presented today on the phone are really faced with nothing but difficult choices, right? So they have several choices in front of them, and none of those choices are easy. So I do want to recognize for those of you that are listening in that tireless work has gone into making decisions amongst a series of not good choices, right? Thirdly, I want to emphasize the importance of using data and using science to help us make the tough choices that we have to make. So if we're going to have to make a tough choice, we want to base it in science and data. And I do feel that the organizations that are going to present today have worked really hard to do just that. And finally, I just really want to request for everybody who is listening, everybody who's participating, that the harder this gets, the more we have to come together and the better we have to communicate. So I know that there are some hard questions that are going to be posed today. I know that there are some concerns that have been brought forward to our department over the last couple of weeks based on the difficult decisions that have had to be made by the organizations that are represented today. And I ask that we all come together and we work really hard to work some of that out. We can better our communication, we can get more information out, we can provide more transparency, and then we need to buckle down and work together because this isn't going away. So we just need to get it done together. So I thank everybody so much for being a part of this, and I will turn it back over to the next presenter.
Thank you, Amanda, for the wonderful insights on what's happening at the state, region, and county levels. And thank you and your staff for all your work during this incredible time. Next, I'd like to turn the stage over to Dr. Weisman. Dan, go ahead.
Hello, Boone County community. I appreciate the opportunity to speak to you today. I just want to start by going back a little bit. I'll remember Friday the 13th. It was Friday the 13th, 2020, probably in many ways like I remember September 11th. After we had spent months in our schools hearing about this new coronavirus, the idea that all of the schools in the state of Illinois on that Friday the 13th, were being ordered to close was just one part of what's changed all of our lives, probably forever, and in ways we're still trying to understand. One of the unfortunate impacts of this new virus is the difficulty school districts across the country have in not only opening their doors safely, but in confidently providing a consistent and reliable experience. Schools have always been places where communities can balance the social, emotional, physical, and academic needs of their children. We've always had our work cut out for us in this area, and we always need to improve our efforts in balancing these needs. But even when we've struggled, our communities recognize the importance of providing a balanced, safe place. COVID-19 has upended that balance. There's no longer a general social agreement that schools can offer that balance. Even while schools are being asked to open across the country, the skew of those needs has swayed so heavily toward the physical needs, with less regard being given to social, emotional, and academic needs. While we had initially revealed a plan to start in person with an attempt to balance those needs, after planning for that scenario for a handful of weeks, I began to fear that we would not be able to follow what was referenced as the IDPH, or the Illinois Department of Public Health and State of Illinois Board of Education guidelines enough to open or at least stay open for any period of time, which would make it difficult to provide a reliable experience for our children if they came in person. I was most worried about the quarantine needs of staff and students in an in-person environment. The risk of opening seemed to be that schools would simply be upended within days or weeks, forcing families to find overnight solutions and children to relearn different structures and processes they had just become familiar with after not being in school for months. And we would be forced to focus our daily attention on contact tracing and regular quarantines of staff and students instead of learning. Just this last week, IDPH and the Illinois State Board of Education put out guidelines for temporarily shutting down schools for outbreaks, for example, which they define as when 2 or more people with shared contacts or locations test positive. They also sent out guidelines, updated guidelines for keeping students and staff home for up to 14 days if they become sick with COVID-like symptoms, including coughing or a runny nose. While I don't blame the State Board of Education for coming out with those types of strict guidelines, they became very difficult to confidently comply with. So I joined over 175 other school superintendents in the state and made the recommendation to our school board to begin school remotely. The districts, these 175 districts range from Carterville in southern Illinois to Decatur in central Illinois, all the way up to the Wisconsin border with our neighbors up in the North Boone School District. While this is a very difficult situation for all of us, I'm hoping that we're able to provide the most consistent experience throughout the year by focusing our efforts this way. We're initially offering daily in-person learning and weekly in-person support to a small number of students based on unique needs. This helps us keep the number of students that are in the schools really low. They're mostly students who receive intensive special education support services or English acquisition services, or students who score in the lowest 5% on reading and math. We are reaching out to eligible families both before school starts and once the school year has started to provide these services. But most of our students will learn remotely. Remote learning this year is significantly enhanced from the spring. We've increased the amount of training teachers are getting this month by 5 times. All of our students, kindergarten through 12th grade, are receiving a Chromebook to use for their learning. Our teachers will be providing live, interactive, and real-time instruction throughout the week with video conferencing tools. And we set aside additional time each week for teachers to contact families to help support the needs they have at home. There's a few important points for the upcoming year I think are important to know. We can go to the next slide. First, we're taking attendance every day and every period. This is a state requirement that was waived in the spring but has been reinstated this year. Some parents ask what will happen if their child cannot log on during the day. The answer is easy. It's the same thing that would happen if they didn't come to school in a normal school year. They would be marked absent, but the teacher would provide resources for them to make up their learning on their own time. In many cases, this means the teacher will be recording their real-time lesson for parents to review with their child after. And the grading environment that we have, we call it a proficiency-based environment. Attendance doesn't directly impact a grade, but most students will have the best experience and families will benefit most from their teacher's knowledge and skill if the child is able to interact and receive daily support directly from the teacher. We'll go to our next slide here, and it has to do with grading. Grading will happen this year. Last spring, we were actually directed by the state not to harm children's grades after March 13th. But this year, that's also changed, and regular grading practices will continue. Because the district has been shifting to a grading environment that rewards skill attainment and not seat time, I believe we're set up for a more equitable system here and can focus on the most essential skills. But it's important to remember that students will be graded on whether they are competent in those most essential skills. The next slide will talk about expectations for work every day. Families should expect that students spend about 5 hours each day learning in a remote environment. Schools traditionally have schedules, and our enhanced remote learning plans have schedules built into them. The next slide talks a little bit about what those specific schedules look like. So in early childhood, virtual instruction will start with a whole class check-in for about 15 minutes. Then they'll have real-time instruction through those video tools for about 20 minutes. The teacher will then have small group conferences for 20 minutes through those video tools, and then they'll end their half day with another whole class review for 20 minutes. Early childhood, they have an AM and a PM session. It's just a half day session. The next slide talks about elementary school student schedules. Their day will start at 8:30 with a real-time whole class morning meeting. A student may have real-time instruction in math at 9 a.m., reading at 10 a.m., a break for lunch at 11, a real-time live science lesson at 12, and art at 1 o'clock. The teachers won't be streaming their instruction for 5 hours straight, but they'll start each hour with a mini lesson, explain to students how to do some independent work, and then the students will log off the video. Maybe they'll take a break, do the assigned work with the support of their family, get their wiggles out, and come back on at the top of the next hour. We've designed our elementary school schedule to be easy to remember, so all the activities start on the hour. Middle and high school students will have 4 periods each day with a lunch break in the middle. Their periods are each 75 minutes long and will start and close with real-time whole class meetings and instruction. Teachers will be available to coach and support students virtually during the class period as students maneuver through projects, readings, videos, and assignments, much like they normally would in a classroom. The next slide talks a little bit about safety and privacy. All of the assignments that I'm talking about and video interactions are done behind a safety wall and a login-based password protected system. Last year, because everything happened so quickly, we kept most of our assignments public so parents could easily access them and help. Parents will need to know that they still can help and support, but they'll need to make sure their child logs in to see the assignments and supports. Each school has a virtual back to school night during the first week of September before school starts, and we have virtual parent support sessions scheduled in the same week. These will hopefully give parents a clear understanding of what they can do to help their child in the home. We'll share tips on helping children with consistent schedules, making the technology work for you, and communicating with teachers. We're also providing support sessions for childcare providers in the area so they know how to support children during the day with their learning expectations. I know and recognize this is really an impossible ask for many of our families. All I can say is that I wish we could offer in-person services this year to start out the school year. As an educator, I wish I was able to offer a different solution, and am also frustrated with our inability to do so. As a parent, I've had to hear my own children admit that they would be more excited to start if they could walk into their school, open their locker, have lunch next to their friends, and bump shoulders with others in the hallway. Schools are usually places where we share pencils and papers, notes and novels, hallways and lockers. For most of our students, school is going to start out differently this year, but we're going to put our best step forward in a different environment because school is more than just that. School is community and love and attention. School is where our children feel important because everything is done for them. We're going to continue to do everything we can for those children to provide community, love, and attention in District 100. I appreciate all of our District 100 families that make our community. And with that, I'll give the mic back to John and the other presenters.
Dr. Weisman, thank you for taking time today to go over the details of the back to school plan. I can only imagine it was not an easy process with the constant guideline changes. I know I speak for everyone when I say thank you to you, your administration team, staff, and volunteers as we prepare for this school year. Next, we have Jen Jackie up from the Belvedere YMCA. She will be discussing child care resources and options available in and around Boone County. Jen?
Hi, thank you. So I want to start off by thanking you for the opportunity to share information today. We know that this situation is not ideal and that the pandemic has placed a huge strain on families and that they've had to make difficult decisions. So today I want to share with you some information on how to choose the right child care and resources to help families who are facing a need for that service. The resources I will share are in regards to licensed and licensed exempt child care facilities. The presentation slides will go out after the presentation, and they have links in there to click on and all the phone numbers and that sort of thing. So you don't have to hurry up and write them down right now. The first link is one from the University of Illinois, their Child Resource Services. It is just a really good tool for choosing the right kind of childcare for you, whether it is a home setting, a licensed or license exempt home setting for your child, or in a daycare center. This document walks parents through the benefits and considerations to think through regarding both options. We know each family has a unique situation, so that is a good resource to think through some thoughts that maybe hadn't crossed all of our minds yet. The next resource on here is YWCA Childcare Solutions. Yes, childcare is an added expense. We all know that. YWCA provides assistance, though, to families who are in need. And along with it, they have a list of licensed and license exempt providers for the community in both homes and in daycare centers. For families who don't know if they qualify for child care assistance, there's a handy calculator that you can plug in your information, and it will tell you if you are indeed able to get some assistance. Once you're approved for assistance, a family will be assigned a copay by YWCA, and then the family pays that directly to the care center. And then the care center bills the days that the children are in attendance at the center. So it's a really helpful resource for a lot of families in the community. The next slide we'll go to covers ratios. Just so that you know what ratios for licensed and license exempt facilities are put out right now during the pandemic. For school age care, daycare centers, the ratio is 1 to 15 in a room. The children must be separated in the rooms. They can't cross over into different rooms, and the staff must be consistent in each room, just to help minimize the risk of spreading any sorts of germs. The next slide discusses face coverings. We know none of us are super fans of wearing a mask, but we do know that masks do help prevent the spread of germs. Children in licensed and license exempt care do need to wear a face covering. School-age children do need to wear it. They need to wear it except for when eating and when outside. And during those two activities, they also do need to be socially distanced so that the reduction is there too. The next few slides are very in-depth, so I will just gloss kind of over what it is, but they are the health screening and safety. For license and license exempt settings, children will be screened daily with a health questionnaire that their parents or guardians will need to answer, and then they will be, their temperature will be taken. Their temperature does need to be under 100.4. Additionally, outside visitors they should not be in the classrooms, and the staff will also be checked daily as the participants, the same thing, the temperature and the health questionnaire. And again, staff will not be switching rooms. They will be staying in a specific room in order to reduce the spread. With that, we can jump to the next one. Next slide, please. All centers have obviously increased procedures to ensure cleanliness. So you'll find a lot of them using the Clorox 360 machines, disinfectant logs to make sure that they're following the schedule, and really working with the children on making sure that they stay socially distanced and that they understand the procedures and cleaning procedures in place too. Next slide. Like I said before, the pandemic has made things difficult for many of our service providers, made it very difficult, but many service providers have stepped up in the community to provide support and care for families who need that assistance. Here is a list of providers in Boone County. These are all centers or camps, but again, YWCA has a list of home-based care that may be a better option for your family. I'm going to shift on the next slide just a little bit and go over what the Y care looks like. The Y is a license exempt facility, and we are providing care on site at the Y. Our hours of service are 5:30 a.m. to 6 p.m. And we accept private pay, child care assistance program through YWCA and DCFS payment. We offered 60 spots, 4 separate rooms of 15. Unfortunately, at this time, the majority of our spots are taken, but we do have a waiting list for children who are interested, families who are interested in needing the care. Our services, we have 2 licensed teachers on staff to guide our curriculum and support, and we'll be following the school schedule. After school hours, we will be doing a variety of activities such as tutoring, structured physical fitness, STEM, crafts, and swimming. And we will also be working with virtual partners such as 4-H, Boone County Drug Prevention, Belvedere Police, and other entities to provide virtual activities and options for our participants. Staff is going to be going through a rigorous training to be able to support learning and safely provide care during this time. And even though we may be full, I am always happy to help any families either figure out how to apply for assistance or find other care options for them. For all of the details on the why, or for my information, you can visit the website, belvederefamilyymca.org. It has all of our information, spacing, guidelines, details. So I just want to thank you and thank everyone who is attending, and thank everyone who is working so hard to provide the services for the families in the community. And I'll turn it back over to John.
Thanks, Jen. Some of the biggest concerns we're hearing about are childcare options for working parents. This is definitely some good information for those parents and guardians who are still looking for options. It also sounds like precautions are being carefully taken to ensure our kids are safe and in their childcare surroundings. As a reminder to all of our attendees, please continue submitting your questions using the Q&A feature. We continue to monitor those coming in and will answer those at the end of this presentation. Our final presenter today is Mark Pentecost from the Belvedere Park District. He will be sharing some information about day camps they are running, which is another option for working parents.
Good afternoon, everybody. Thank you for your time this afternoon, and I appreciate. Am I being heard?
Yes.
Yeah. Okay. Sorry. Thank you for joining us today. I wanted to share Amanda's sentiments and acknowledge all the hard work and efforts that have been undertaken by the health department, community unit, school district 100, the YMCA, and every other service provider in this community that's been working diligently to try and find some sort of answers for services that we can help provide to this community to help meet the needs. I also want to just quickly say thank you again to the school district. We have an ongoing partnership and have for some time for our after school program. And so what I'm presenting today really is some sort of expansion to what many of you might already be familiar with in our third base program. So I'm grateful that we're able to still continue that partnership even in these troubled times with the school district, and being able to access their sites to be able to serve more kids and more families in our community. The fall camp will take place at what are our typical third base sites. So Caledonia, Lincoln, Meehan, Seth Whitman, and Washington Academy. We are open from K through 8th grade. So it's a little bit of additional service from what you would see in our normal third base program, which would typically just be for the elementary kids. We, having been given the access to these sites, can help up to 225 kids at any given day, which is a good sizable amount, and we're well underneath those thresholds right now. So we do have plenty of space to try and help families out as we speak today. Our camp actually kicks off next week, Monday. Our typical registration deadlines are the Wednesday prior to, but we're going to give some graces to get us jump started. We go to the next slide. The staff that we'll have on site are the counselors. They're not teachers, and I just wanted to make sure that that's clear. We're not there to tutor or to help your student learn or your child learn. We are there to simply help monitor their activities and maybe help some assistance with technological issues that they might have with getting into their Chromebooks, and just kind of helping them stay on task. So our camp is a blend of those, of us helping your child do what they're supposed to be doing for the day when it comes to their e-learning activities, and then blend of that of what would be considered more typical camp-like setting, recreational opportunities when they're not doing that. So that blend will happen throughout the day. Clearly, the students will be under their schedule with the schools, and we'll honor that, and we'll help them stay on task during that time. And then post that or pre that, we'll be encouraging the students to participate in what would be other, indoor and outdoor types of activities to help engage the child and give them, a quality place to be while parents have to be at work. Next slide, please. We would encourage that they please bring whatever they need to do their e-learning. So they're going to have to bring their Chromebooks, they're going to have to bring their textbooks, they need to bring whatever other supplies they might need to be able to conduct themselves in doing that e-learning. Another thing that we are needing, at least at this moment, is for the child to bring their own snacks and lunches. We don't have access to that at this point. We're working to see if there's some sort of change that we can have. But currently, as we stand, we'll need the children to bring their own snacks and lunches. We are a nut-free environment, so we try to make sure that, everybody's aware that we try to honor that component. Outside of that, we'll be able to provide all the other supplies that would be needed for recreational or camp opportunities and services. So just the things that they're going to need to be able to conduct themselves and the things that they would need to be doing kind of independently. Next slide, please. The fees and registrations, as far as we've kind of worked in coordination with a lot of the other service providers as to what would be a fair and equitable price, or what we thought would be a fair and equitable price to be able to provide the services. We're all kind of within line with each other, and that's, I think, we just want the community to understand that we are here to try and help. And although there are fees that need to be exchanged for us to be able to provide these services, there has been a lot of effort put into that as to how we think, or what we think would be an affordable option for the participants. As I kind of indicated earlier, our registration needs to be done with the park district. We need to do it online and fill out the registration forms and the waivers and everything that goes with that. We do have the deadline of the Wednesday prior to that prior to that week of service on that Wednesday at midnight. We are going to try to make some exceptions for the first week or two, just because everything's coming out so fast and everything is coming out so kind of last minute here. So we're trying to be a little less rigid in that, but as we move forward, we're going to need to be a little bit more upholding to that threshold. As far as anything else that might be concerned with that, we do and are planning on being in session. You can get all this information on our website, but we will additionally be in session for what would typically be days off of school. So they had institute days that were scheduled, or if it was fall break, and we're not to the fall session of registration yet because we don't know how this is going to unfold. But if we got to like the fall break where school would be out for a few days, those days we plan on still offering the camp. I just kind of want to put a couple of those nuggets out there for everybody. We do have a couple different options for payment. We do installment billing, so you can register out as long as you would like for what is currently being offered, which right now goes through the first quarter. So that would get you the first week of November. Within that installment billing, we could do direct deposits. As far as, next slide, please. I'm sorry, one more. Kind of jump into the COVID-19 guidelines. We, just like everybody else, are kind of following the same guidelines. We're really relying heavily on the CDC, the Illinois Department of Public Health, on what would be a safe environment, something that you would trust your child to be part of, and then knowing that we are going to do our due diligence in following those guidelines. So again, with that being said, all of the typical things that you would see with COVID-19 and the guidelines that are in place for us to be able to offer this service and in a safe fashion are going to be upheld. So a lot of this is just going to be regurgitation of things that you have to do already in your daily life or whenever you participate in any other type of service. We will have a zero tolerance for certain types of activities. So I just want to make sure that people are familiar with that. If those things were to occur with your child, just a quick, we do have a zero tolerance on a couple things. Face coverings are going to be required in many situations. We're going to ask that the students have the face coverings with them at all times. When they're indoors, they will definitely need it. When we're outdoors, we will allow face coverings to be removed if social distancing can be observed. If it can't, then the face coverings will have to be back on. So hopefully that will help with some of maybe the more, if they're exercising or playing some games and they're outdoors and it's a little warmer, to be able to take that mask off, I think will be of a benefit to the child. But again, it's all going to be within those safe practices. We're going to be outside as much as possible. We'll be at the school sites. We'll have access to the playgrounds and the fields, but we will be really working to stay outside as much as we can, again, to just kind of help with that process. Clearly, when they're doing their school stuff, they'll be indoors. But when we're in the camp component of the day, we'll really be encouraging outdoor activity. We'll, again, just kind of going after all the typical CDC things, washing your hands. We're going to be encouraging sanitizing of those. As far as, next slide, please. As far as disinfecting, cleaning procedures, when the site goes, I'm working hand in hand with the school district. There's going to be a coordination of effort there between the school district staff and the park district staff, and how we make sure that those spaces that are designated for a child or shared spaces or, common things that we just can't get away from, doors, et cetera, are being cleaned and sanitized on a regular basis. The school district has stepped up to make sure that, that they're getting at least the dailies on the things that are within the premises of the schools. And we will be making sure that we're dealing with anything that might have a common contact before somebody else might have access to that. And at the end of the day, or prior to the next day when another child might come in. Next slide, please. Again, following just the typical health monitoring standards when it comes to participation in any of our programs. We have a form that will have to be turned in every day, and you can get access to that on our website, but it's basically a self-screening in our field. We won't be doing temperature checks on your child. You will be required to do that for us before you drop them off, but there is a form that you can get with all the different boxes that you would need to check before you can drop your child off. As far as if somebody were to get sick or if we have anything that's going on of that nature within our program, we have a lot of safe measures in place for how to deal with that as well. A lot more detailed information, again, in our parent packets and our registration forms when you go on our website. But I do just want to make sure that everybody really understands that there's been a tremendous amount of discussion, a tremendous amount of dialogue back and forth between different agencies, staff, on how we can make sure that we're providing the utmost safety for your child while they're participating in our programs. As far as any other safety protocol goes, I'll just defer it to our website, which is at belvederepark.org. It's, again, just a lot of kind of the same stuff that you're going to experience everywhere else that you go. So for that, I will wrap up my piece and turn it back over to John and what I believe might be Q&A.
Mark, it sounds like you've been able to work closely with the school district to provide another option for those still looking for childcare. We know it's not a substitute for in-person learning, but we can appreciate the schools and park district's ability to adapt during these unusual times. This has been some really great information shared today. I know this answered a lot of questions for me personally. Before we move into the questions that our attendees have submitted, we want to make sure to take time that the contact information that you all have for each of our panelists. As a reminder, this is being recorded, so if there are any portions you missed or would like to review again, please watch for a link to the recording in the very near future. At this time, we'll go ahead and begin answering questions that you have submitted. We continue to accept questions through the Q&A feature. Again, we ask that questions and comments remain respectful. First of all, why is Boone County behind Winnebago as far as reopening schools and businesses when Boone's virus numbers are substantially lower?
Yeah, I can take that question. So I think in these scenarios, every school district in every county across the state is looking at individually what they can do as a school system to make sure that they open safe. While the virus numbers and the outbreak cases are definitely part of the decision making and would force us possibly to close. The other thing that we're asked to take into consideration is the confidence that we have in being able to follow all of the IDPH and State Board of Education guidelines. So every school district just has a different perspective on their ability to follow those guidelines, I believe.
Thank you, Dan. As a follow-up to that, why are teachers in school remote teaching children that are not allowed to be in the classroom setting, yet can be there through the Park District and $600 a month?
That's a great question. So I would say that there's probably a significant difference between bringing in 500 students to an elementary school all day and bringing in 50 students to a school for a Park District supported childcare. So there's many more students that are in a school on a daily basis if we return to school in person fully, as opposed to a really small targeted number of students that would come for a daily care program through the Park District.
Thank you, Dan. We've had a question come in. You shared expectations for students, parents, teachers, and all stakeholders. Will there be accountability? They were outlined here. However, can you ensure that these expectations are clearly communicated?
Yeah, I appreciate that. I think one of the things that we've tried to do is increase the amount of training that teachers are getting over the next 2 weeks. On a traditional school year, teachers have 2 days of training to prepare for the start of school. In this scenario, we have 10 days of training. They start on Monday. So we believe that the increased training will help with the communication, expectations, and accountability for our staff moving forward.
Seems like we're featuring the schools, but I know that's such a big concern on so many people. I'm going to read this one exactly as it's written. I'll let you try and interpret it, Dan. When will things like speech and OT fall into the daily schedule?
Great question. So things like speech, occupational therapy, which I believe is what the OT refers to.
Yeah.
Speech therapy is, I think, what she's referring to, or what he or she is referring to with the speech. Let's see, vision services, counseling services, social work services, vision services. We call these all related services. And related services providers will be reaching out to families during the month of September to ask families if they're most comfortable with an in-person service or a virtual service, and then we'll schedule that on a one-on-one or small group basis for those individuals to come into the schools. We do believe the schools are still safe places to come into with limits on the number of people that come in. And as the school year progresses, we'll see how that may increase or decrease. But those types of related services will be scheduled individually with families so they can come in and receive those.
I think all of us here living, working, enjoying Belvidere and Boone County, we've seen so many efforts on so many businesses to take care of things, keep things clean. It's a very hard task, and we all need to work together. Here's a very interesting question. Will there be social emotional support for our students? Remote learning has been significantly harder for some students in regards to mental health, and it tremendously affects their learning process and successes.
I agree. This is very difficult. I even mentioned earlier in this webinar how it's been difficult for me to listen to my own children talk about how much they want to be back in school and how much school means to them from a social interaction standpoint and emotional interaction support standpoint. So I think one of the things that was really difficult this last spring is that a lot of students were left on their own without direct support from a teacher, a lot of interaction from a teacher because of the limitations that we had around training. So we will be providing on almost a daily basis live interaction from the teacher. Part of the reason we have increased training for the next 2 weeks is so that teachers know how to use those live real-time video conferencing tools with students. They have training on how to do that effectively. We'll be receiving some training on how to provide social and emotional support 2 students through a virtual format. If you notice when I went over, I'll just reiterate, when I went over the daily schedules, all of the experiences start off for the elementary school students at the beginning of the day with a whole class, a meeting that mirrors what they would do in their classroom. Everybody gets together, they talk about how their day's going. They might have a social skills lesson, or they might talk about a social or emotional topic. We have curriculum around that, and the middle and high schools, they get together and they meet at the beginning of every period for that type of discussion. And so we've tried to build in ways for that to happen during the school day. And then once a week, we have what's called conferencing. And this will allow a teacher to reach out individually to students or individually to families and parents, interact with them on an individual basis, find out specifically what they need, provide some coaching on maybe some different topics, or maybe just listen to some of the struggles that the home is having or the individual is having, so they can figure out how they can best support the child and the family. So we've tried to build in some supports for those areas.
Thank you, well put. Amanda, I think this next one might fall to the health department side. I think most of us working parents would like to understand why it is okay to have kids gather for childcare but are not able to be in a classroom. For those of us that don't qualify for financial assistance, this is still a large financial burden for all of us.
Sure, so I can address some of that. I know that Dr. Weisman covered a little bit about the fact that school buildings are still safe places for gatherings as long as guidance can be followed. Just want to reiterate the fact that we are in phase 4, which does allow for gatherings of up to 50 people as long as the space allows for that safely. And I did hear the park district and the school district talk about social distancing, masking, spacing kids out, the format of the day for children that will be receiving in-person opportunities, whether it's day camp through the park district or services through the Y that would allow for safety precautions to still be met.
Very good, thank you. Dan, does the district have a projected reopen date for in-person learning? What is the criteria that needs to be met to return to in-person learning?
So we're targeting the end of the first quarter for a return. That would be that first week of November. And I think there's probably, I'll go back to 2 different factors in decision-making that will continue to be factors. The first is the data around our phase 4, continuing to stay in phase 4, regional and county metrics for phase 4 that Amanda went over. If those continue to stay in a good position, then we're more likely to be able to return. Probably more relevant is also our confidence in our ability to have an environment where we're not going to have to be sending children home quarantining all the time, and we're not going to have to be sending staff home to quarantine all the time. So we're trying to provide a consistent learning environment for the whole year. And so if it looks like the guidance and the regulations from IDPH and the State Board of Education are such that we would just continue to send students home for short periods of time, we feel like that would probably be more of a disruption for many families. So that's the other factor that we would take into consideration.
Very good. Next question, how come students can't return to school because it's unsafe, but 250 students can return to each school if parents pay $30 per day per child? Will the schools be profiting off the use of the space?
That's a great question. So maybe we can clarify, there will not be 250 students at the camps at each school. That's spread out across multiple schools. The schools are not profiting from the $30 a day. That $30 a day is directed towards the park district being able to, I believe, pay their employees and have their own supplies. The schools are not receiving that $30 per day.
Very good. Next, we are new to the school and haven't been able to tour the school. We are interested in the Park District Camp program at school. Will there be an opportunity to be able to tour the school before camp starts, Or are we supposed to just send our student to a new environment with no prior knowledge of the facility?
Yeah, that's a great question. And the park district may consider a tour. For the most part, though, children won't be at the camps. I believe Mark won't be walking around the entire school. They'll really be either in the gym or the cafeteria. So Mark, I don't know if if parents see the gym or the cafeteria, if you have a plan to let parents see the gym or the cafeteria before they start, they'd obviously be able to drop their children off initially.
Yeah, thanks, Dan. Yeah, if there's a concern in the community or with a particular family that would like to do a tour, we can certainly do that for them. They're just going to contact the Park District office and we can arrange that for them.
The rest of the school, in many cases, the rest of the school is still being utilized. Our teachers are coming every day to use their computer, the internet, their phones, and the materials to provide live instruction. We do have, as I mentioned before, targeted groups of students that are coming in either to receive special education, language acquisition services, those related services like therapy, speech therapy, occupational therapy, and some students that are in the lowest 5 percentile of achievement are still coming to receive some interventions and tutoring. So the rest of the school is being utilized, and the children from the camp won't be in those areas of the school, which is most of the school.
Our next is as much a comment as it is a question for Dr. Wisman. As you begin to plan for enhanced e-learning, please consider that many grandparents are stepping in to support e-learning. Please consider this as you roll out the new technology plan. For example, please limit the number of Zoom links and web-based platforms used each day.
I agree with that. That's one of the reasons why we built in a conferencing day every day, so that if there were individual families that need some extra support, especially initially, to understand how to utilize those platforms, that teachers would be able to reach out and work with those families individually.
Great. Next, my child has an ADHD diagnosis, but would not qualify for in-person support. Will this be taken into consideration when he or she is unable to focus in an e-learning environment? Will there be additional supports in place?
That's a great question. We do have a lot of children that receive either special education services or just might have unique individual learning circumstances that make it difficult to learn in this type of environment. Most of the supports that we're providing for students will be directly from their classroom teacher. So a classroom teacher throughout the day will be able to conference one-on-one with students, meet one-on-one with students, and interact with parents and support parents throughout the week one-on-one if there are some of those individual needs. We aren't providing any specific targeted or otherwise unique supports for students that have attention deficit concerns.
This last comment is more comment than anything else, and I would say it is directed to all of our presenters here today, but it specifically says, thank you, Dr. Wisman. I know you're in a tough position. However, I know you are doing everything that you can for our kids. I would say that every one of the presenters here today is doing the best that they can for our children and for our community. And that's what we're all striving to do every day. We would like to thank everyone for taking time out of their day to join us as we provided information about the upcoming school year in District 100 and childcare resources. A special thank you to our panelists for all you do for our kids in our community. Once again, I'd like to remind everyone that this was recorded and to watch for the recording coming soon. Thanks. Have a great weekend and take care, everyone.
Thank you all.
That was a great webinar.